Namaste. Hello, this is Natsuya Uesugi, and I just wanted to talk a little bit today on writing mental health on a new program that I'm doing. Because I got out of the hospital recently, which was inpatient, you have to next do a day program, and that's kind of, it's an outpatient program that is part-time, so you spend the mornings or the evenings at the location, and that it's a group dynamic. And usually I'm kind of new to group. I've never really done group before. Well, I've done group a couple times, but I'm not good with groups, so this is something I definitely have to learn. So I went for the first day, and usually what I've learned is that these day programs, they focus on, or at least this one, I was in one day program, and I literally got kicked out of the program on the first day. I'm not sure why, but the program I'm in now is more liberal friendly day program, which I think is awesome because as an intersex trans person, I get to actually, be with other people, and I think that is actually very awesome. And so I've been to the program, this new one, once, and it's a group. So group dynamic is where you have a bunch of people, and you usually have a counselor, and maybe there's a moderator, and you talk about different subjects, and they go around. So if you're familiar with AA or something like that, I actually went to, I think, an Alcoholics Anonymous, one meeting once. One of my siblings wanted me to go. So I said, okay, I'll go. And I think the difference is that in those meetings, you can't comment on what other people say. And then I know when I was in the hospital before, a long time ago, you had to go to either AA or NA, and I tried NA, and that is the same thing as AA, but it deals with, instead of alcohol, it deals with, narcotics and stuff like that. So that was interesting too. And so those programs, if there's something that you're interested in, definitely do that. So this day program, we were dealing with, the topic yesterday was self-care. We were talking about that, and we were also sharing. I didn't really share because it was my first day, and I was introducing myself to it. But I was a little late to the program. It was a half-day program, and people were sharing different things. But the good thing about it, or what was different, was that there was a counselor moderating. There were about maybe 10 people in the group. And they were all from the LGBT community, which was great. Just different identities. And people were sharing. We were talking a little bit about, different things. And I thought that it was great that people got to provide feedback and actually, learn from each other. And so that I thought was very awesome. And so this is my first time being, I guess, in a day program type thing. I think it's called partial outpatient, like AOP or AIOP or something like that. I'll look up what it's called because it's an official name for it. And this program, meets for a specific period of time, a certain number of times during the week. And I think that it'll be great because I will learn some new skills. And definitely it's a transition for after you are inpatient for mental health. So this is a whole new paradigm for me, and I'm going to be sharing some things from it. So, not any, material about content, but just sharing kind of my experience with this new phase of mental health that I haven't experienced before. So thank you for listening, and I will talk to you soon. Peace.